This week, Ector County Independent School District suffered the loss of one of our students, one of our young students, a third grade child. And today we extend deep and sincere sympathy to the family of that young man. His family lives in our community. In fact, his extended family also lives within our community. But I cannot imagine anything more tragic than the loss of a child, especially a young child at that age. So again, our heartfelt condolences to the family of this young man. We are providing counseling services to the students. This child had been with us for several years in ECISD, and so our counselors have been actively engaged in both of the schools that this young man attended, and not only supporting the students that he befriended during his years in ECISD, but also the teachers and administrators that he came in contact with. We're providing counseling for those individuals, as the loss of a child in a school system is equally as difficult. And so we want to make sure that we're providing for the social and emotional needs of our children and families. And I would encourage any of our parents that are watching, if your children are experiencing the grief or loss because of this particular young man, please let your school counselor know so that we can provide additional supports for you during this incredibly difficult time. This is also a reminder for all of us of the importance of safety in our community. COVID-19 is on the rise in Ector County as we meet, we being our medical community, the doctors in our community, our hospital CEOs, the city and county leaders. We come together weekly and we talk about the situation in our community as it relates to COVID-19. And on this week's call, we were all alarmed at the rising numbers, and we have to do something as a community to not only limit the spread of COVID, but to make sure that those numbers, our positivity rates, the number of people getting COVID, and our hospitalizations, they've got to decline as quickly as we possibly can make them. And that is on us as a community to do that. Specifically as a school district, we have instituted quite a few things to make sure that our students are safe and our staff members are safe. In fact, school is one of the safest places that our children can be today. We require our children 4th grade through 12th grade to wear a mask every single day, except when they're eating or except when they're outside, and our social distance, we require that mask. We strongly encourage every pre-K through 3rd grader to wear a mask during the day. Our teachers and those that are in contact with your children not only wear masks, but wear face shields. In addition to that, we maintain social distance in our school environments. We teach our children how to properly wash their hands pre-K through 12th grade. Our teachers this year have ensured the safety of our children. And school is also a place that we educate kids, not only in reading, writing, and arithmetic, but this year in those safety procedures. And so where our children come to our school districts this year, they're learning about those safety procedures that can keep them safe from COVID-19. And then they take that information out into our community. I know many moms and dads, in fact, even as I've spoken with a grandparent recently, she has learned from her youngest granddaughter how to appropriately wash hands in the home to make sure that we are clean. And so we thank our children for learning those safety skills in school and for transitioning those safety messages into our community. But ECISD schools continue to be the safest places for our children, as we have a significant number of protections in place to keep our kids and our staff members safe. In addition to the safety procedures that we've already put in place, we're adding some new things. Last week, we announced that we are pausing the phase-in of our students. So our juniors and seniors will not phase into school next week. We will continue to serve them in a virtual environment or in a hybrid environment. And we're going to pause their phase-in until the medical situation in our community has improved. We also added every employee, the 4,200 employees in ECISD. Not only do we wear masks and face shields when we're around children, but starting last Friday, we now wear them anytime that we're traveling around our building. So whenever we come in contact with another, either a student or another staff member, we must be prepared with a mask and a face shield. In fact, each day when I leave my office, I have both a mask and a face shield on, and that is a new procedure that we started last week in ECISD. And then finally, this week, we received 10,000 COVID-19 test kits from the state of Texas. And we will begin a testing procedure in Ector County. We will start with adults. Any adult who comes to school during the day or comes to work and they feel fine, but throughout the day they begin to show symptoms of COVID-19. We have those quick test kits that will soon become available to our staff members, and we'll be able to instantly tell if an individual is positive for COVID-19, and then we can quickly respond to those positive cases. Once we put those procedures in place for adults, we will also continue that same procedure for students. So any student during the school day that would demonstrate symptoms of COVID-19, we will have those quick tests available. With parent permission, we will be able to administer that test, and once again provide any type of supports that student or family would need to appropriately care for that particular condition. At this time, I'd like to turn it over to Dr. Benton. Dr. Benton, again, serves as the medical guidance, the doctor, if you will, on call for Ector County Independent School District. Dr. Benton, thank you for joining us today, and we look forward to hearing what you have to share with us.
All right. Thank you, Dr. MURI. Thank you for your leadership and for your leadership in our community and keeping the schools safe. I appreciate what you're doing. I too want to extend my sympathies and condolences. Very sorry to hear about this tragic event. You know, when it's a child, it always hurts deeply. It hurts for all of us, and I want to send condolences to all that have lost loved ones. But, you know, when we think of a child, we often think of what we've heard in the press of this MISC, or multi-system inflammatory syndrome. And it's a very rare event. It happens, you know, several weeks after a COVID infection. In the United States, there have only been about 1,000, a little over 1,000 cases, and in Texas, 54 cases. There have not been any confirmed cases in West Texas. We know, though, as this pandemic is spreading, that the infections in children are increasing in number. Thankfully, they're not severe. You know, they generally do better than the older. So if you even look on the Ector County website, the health department, you'll see that the cases are increasing in younger people, younger ages, but the deaths are more to the older age group. That does not make it to where we should be lax in any way. And the guidance you just gave, which is perfect explanation, that we should continue our masking and continue our distancing and avoid large gatherings of people. That's the best way to control this. And controlling this is best done at the community level. So again, I really appreciate your guidance and your leadership in this too, as well as everybody else on the screen. It's a tremendous leadership. Thank you.
Thank you, Dr. Benton. We appreciate those words. Russell TIPPIN, the CEO of the medical center here in the city of Odessa. You and I started our journey in the city of Odessa right about the same time, and we've had some interesting experiences, and some of those, Russell, have not been the most pleasant experiences, and including our current situation. But I will tell you, I respect the work that the medical center is doing to keep our community safe, and I know right now you are also dealing with a crisis. So Russell, what can you share with us today?
Yeah, Dr. MURI, thanks for the time today. And we just, again, like to echo Dr. Benton, we send our sincere thoughts and prayers out to anybody that's lost a loved one during this time. The crisis is real. COVID-19 is real. At Medical Center, we are seeing a definite increase in our numbers, not only in the number of sick people in the hospital, but the number of sick employees that we have too. We currently have 81 employees that are out due to sickness with COVID-19 and 68 patients in the hospital, with plenty more waiting in our emergency department today. Dr. MURI, we'd like to applaud you and your crew and what y'all have done at the school to keep those kiddos safe. It's been amazing to watch the school district and ECISD put this together and to keep your staff and your teachers and students safe. And so we appreciate the work y'all have done to try to slow that down. At the school level, definitely in the community level. And what I just want to say today is to remind everybody that washing your hands, wearing your mask, and social distancing is very important. And we also know that the school has done a great job. They're not the place of infection. Y'all have done a great job of keeping those kiddos safe. But when you get around other people and you get in groups and you get in people's homes or large gatherings, your chances of getting this disease, they rise, they go up. And so we just want to encourage everybody to fight the good fight. We know you can get mentally exhausted from this, but at the same time, if you can look at the school district and what they've been able to do, they've been able to perform very well during this time. And we want to encourage everybody to keep wearing your mask, keep washing your hands, and staying as social distant as possible. And Dr. MURI, thank you for your work at the school. Good job.
Thank you. I appreciate that. Thank you, Russell, for your leadership at the medical center. Just partnering with you in this effort to keep our community healthy has been appreciated. So I value your wisdom and the work that you're doing. Stacy Brown also joins us. Stacy is the CEO of, I always want to call you Orlando Regional because I lived in Orlando for 11 years and ORMC was always Orlando Regional, but you are Odessa Regional. But Stacy, really you and Russell both make an incredible team. It's nice to see our two hospitals, rather than being competitors, you are partners and colleagues in this work together. And so I thank you both for setting an example for our community, but Stacy, thanks for working with our school system and our community to support. I know it's incredibly difficult for you right now as a hospital, so Stacy.
Thank you, Dr. MURI. And first of all, we too want to extend our condolences to this young man's family and all of his friends and teachers. We can certainly, those of us who are parents can understand how difficult that is for everyone involved in that, as well as all the other families, as others have mentioned. We are seeing a significant increase across the community, as has been said. Odessa Regional has 25 COVID patients in-house today. We have 32 or 34 employees who are either out with community-acquired positive exposures, positive cases, or they're having to quarantine because they had a high-risk exposure. And so when you think back on what this was like for us at the end of June, early July, when we were seeing the peak at that time, this is much different because it's not just the community, but it's also your healthcare workforce that is now being significantly impacted by this current surge. As most of you know, I'm also the president over Scenic Mountain Medical Center in Big Spring. We're seeing very similar, if not more alarming numbers there, quite frankly. The census, the COVID census there today is 21. And we have 16 employees out either due to high-risk exposures or positive COVID cases. Big Spring is much smaller than Odessa is. It's about 38,000 people. So this is definitely pushing concerning numbers, not only from a healthcare resource standpoint, but just how quickly we're seeing this continue to increase. As we are looking at these things, I think our biggest concern from a healthcare community is we don't want to be in the position that we're seeing in other markets around us, such as El Paso and other places, where they're having to bring in portable morgues, where they're having to make very difficult decisions on who gets what care. And so what we really want our community to understand is that this is very real. Our healthcare resources are being pushed to the limits. We're working on surge plans. We're getting resources from the state and other areas to help. But if it continues at the pace we're at, we may not be able to keep up, and it could be your family that's impacted by that. And so we just really want everyone to understand that we need you to be very careful and protect yourself and your family and those around you. I do also want to hand it over to Dr. SARAVANAN to talk about our relationship with the school district and how closely we've been working all along in this process.
Yeah, Dr. SARAVANAN, thank you for joining us today. It has been a pleasure to get to know you. I think you're also, one of those folks that is fairly new on the scene in the city of Odessa, but it's been an honor and privilege to partner with you in this work. So thank you for joining us today.
Thank you for having me, Dr. MURI. I think lots of what needs to be said has already been said, but I do want to reinforce a couple of things. One, I heard you talk about the positivity rate and the hospitalization rate. I want to put numbers to that today. Our community positivity rate is over 35%. As a comparison to some of the other bigger cities in Texas, you take Austin, for instance, they're about 4% positivity rate, 4%, and we are at 35 plus. Or you take Dallas, they're about 8. Take San Antonio, about 6 or 7% right now. So I just use that as a frame of reference of where we are. El Paso is at 45. So you see which direction we're moving and how we need to correct course to prevent us from becoming the next big site like El Paso right now. The second number is the hospitalization rate. That's the total number of operational beds in the hospital. What percent of those beds are being occupied by COVID-19 patients? And that's over 15% now already. And that's the threshold that the governor had set before for us to talk about how we should respond as a community. You know, what we should do with businesses, what we should do with different avenues that people get together with gatherings, etc. Especially with the Thanksgiving season coming and the holiday season and Christmas coming, we need to reconsider our options very carefully based on what's going on in our community. Our response here will not be the same as some of the other places that may have better control of this disease process. We are at a point now that our surge currently is larger than the surge that we had in July. We have more beds occupied, we have a higher positivity rate than our surge in July. So we need to take that seriously so we don't get to a position where we're having to choose how we deliver care. We want to do the best for every single patient that walks into the hospital, regardless of how many patients are here. And so we are doing our best to increase capacity. If you can do your best as a community to decrease the incidence, the prevalence of this disease in our community, I think we can work together to get through this on the other side. The one thing we didn't mention on this so far is the vaccine. As you know, we got some good news recently from Pfizer that said, hey, we have some good efficacy data that's coming out of our phase 3 trials. Good, very good. That's optimistic for us to look forward to the future and to say the vaccine is on its way. It's probably not too far out, maybe a couple of months, and we'll have at least the first shipment. But the point is that we can look forward to the light at the end of the tunnel and keep our precautions in place and get through it in a safe fashion. Last thing I want to reinforce that we already talked about today is the fact that the schools, ECISD, also I want to call out UTPB and Odessa College, they all have put great precautions into place and they are showing the community how it can be done safely. They are a place where people congregate by definition, by going to school, but they have not added to the disease burden in our community. Their rates are reflective of what's happening in the community, not adding to what's happening in the community. And that shows us how it can be done well. And so we need to take that example. We need to say, hey, these masks work. Hey, the masks and face shields work. The social distancing works. That's why their rates are low. So we need to take their example into consideration and do that for the whole community. Thank you, Dr. MURI.
Thank you, Dr. SARAVANAN, for those words. I've said often that right now, our school district and our hospitals clearly are being victimized by this virus. You know, the spread that's happening in our community, we see the results of that in our classrooms. We see it in our hallways, and you're clearly seeing it in the hospital. It affects our children. It affects our adults. It affects our ability to do work, whether it's the work that you're doing as a hospital to take care of sick patients or the work that we're doing as a school district to educate kids. Our community coming together and doing the right thing will ensure that our children and the adults of our community remain safe, not only next week and next month, but for years to come. And so as the superintendent, I really implore our entire community to do those 3 things that we've all been called to do. To make sure that you're wearing a mask at all times, to make sure that you are maintaining your distance from other people, and to make sure that you keep your hands clean throughout the day. Those 3 simple acts will help each of us as a school system and as hospitals to do really good work for our community and those that we serve. And then those 3 actions will help all of us get through this pandemic together so that we can have a better day on the other side of this. So I want to say thank you, doctors, and thank you, our hospital CEOs, for joining us today. It has been a privilege to partner with you as we do this work. We would not be the school system we are today, and we wouldn't be as safe as we are were it not for the guidance and the wisdom that you have each shared with us along this journey. So thank you for joining us today. With that, we'll open it up for any questions. Again, members of the press, you can either unmute yourself or put your question in chat. Either one is fine.
Scott, Mary, can y'all hear me?
We can, yes, ma'am.
Awesome. Okay, so I just had a few questions about pushing that phase-in back. Do we have any more details? Do y'all know when y'all are going to go back to class 5 days a week? Can you give me more insight to that?
So right now we are pausing the return of our juniors and seniors, so just the 11th and 12th graders right now, and we have not put a date on that. We're going to wait until the health conditions in our community are in a much better place. You know, you heard the doctors talk today and our hospital CEOs about what we're seeing. Now is not the time to do that. And the hope would be early December, but if it's January, then it's January. But we will not return to the phase-in until it is safe to do so in our community.
Okay, and then actually one more question.
Certainly.
Okay. So as far as like the plan that you talked about, teachers and staff wearing those face shields and masks whenever they're in that building, is it what else are y'all doing to kind of protect staff and students as well?
Yeah, so we up until this point, we had been requiring any adult teacher, administrator, anyone that was in contact with students to wear a mask and a face shield. And the additional layer that we've added is now anytime you're in contact with anyone else in the organization, whether it's a student or a colleague, you are required to wear both a mask and a face shield. So that additional layer of protection, and again, in listening to the guidance from our medical community, will help ensure that not only our students are safe, but that our colleagues are safe. Those that we may have lunch with, those that we're talking with in the hall, those that we're involved in a meeting with, those individuals will be safe as well, as long as we have that double layer of coverage. And so that's the additional step. Also, the testing, once we're able to roll out testing, anybody, any adult during the school day that demonstrates that they have a symptom of COVID-19, we'll be able to test them immediately and then have those quick results so that we can be responsive to the virus should it invade our campuses. Others, you can, again, either unmute yourself or put your question in chat, either one. I see a hand raised.
Hey, Dr. MURI, this is Dylan with Big 2 News. How are you doing today?
Hey, Dylan.
I was just asking because we've gotten reports on possible outbreaks at Barbara Jordan and Cameron with some teachers, and then we're wondering too, because our understanding is some students go to Permian too for some classes, and so we're wondering about Permian too, about any possible outbreaks. So those are just reports we're getting, but we're coming to you to see, you know, is that factual? Have you heard anything about that? Can you confirm that?
Yeah, what we're seeing based upon our data, our cases after we contact trace come from our community. I do believe in listening to one member of our medical community last week that the #1 cause of cases in Ector County are small group gatherings. And so it's that Friday night community gathering that you go to, it's Saturday afternoon, watching a football game with the guys. You know, those are the things that are creating the viruses in our school. We are not experiencing the spread of the virus in the school district. What we're experiencing are people catching the virus in the community and then bringing it into the school district. And so yes, some of our schools have had a larger number of cases than others, but those cases come from the families and friends and gatherings of our students and staff members when they're in the community.
Hi, Dr. MURI.
Hey.
This is Federico Martinez from Odessa American.
Hey, Federico.
I'm pretty new here. I've only been here 3 weeks, so I apologize if I just butchered your name.
You're good. So welcome.
Thank you. And I arrive at an interesting time, I see.
You certainly do.
Again, to echo what other folks have said, the school district has been doing such a great job. It's probably the safest place right now in the community.
Thank you.
So I applaud you all for that. And As a parent, you know, it was heartbreaking to hear that a third grader had passed away. My question's kind of tough, so to ask and to
Sure.
but how does the school, how do you explain, well, this death to other young people, you know, and I know it depends on their, you know, each individual's level of understanding, but it's such a young age, you know, and I know a lot of sensitivity has to be done, but you know, as a parent, I'm just wondering, you know, what or how can you comfort a child or explain this to a child?
Death is hard to explain to people of any age, and I think, but in particular, our children. You know, we have master counselors in our school district that are providing some really good nurturing and guidance to our children and to our families. Those are not easy conversations to have at all. Unfortunately, death has been a part of school districts for really since we began, whether it be a student involved in an accident, a child that commits suicide, a medical situation, a terminal illness. Death is a part of the work of school districts, and our counselors are well trained in how to support students and staff members as we go through these situations. And so I really lift up and applaud the ECISD counseling team for being experts in providing tools and resources for our children, even our youngest children, 4-year-olds and 5-year-olds, as they deal with these traumatic situations. It isn't something that happens in a day or two or even a week. You know, dealing with the death of a friend or family member takes a long time for children and adults to get through. But again, our counselors have provided great wisdom and will continue to our children as well as our staff members. I would encourage parents, any parent who, if you recognize that your child may be dealing with the grief of loss or the trauma that can be associated with death, I encourage any parent to reach out to your local school, talk immediately to our counselors, and they can provide information to you and walk you through the appropriate conversations to have with your children, again, at any age.
Thank you, sir.
You're welcome. Other questions, anybody?
Hi, this is Violet with News West 9.
Hey, Violet.
Hey, so I know this is an ECISD press conference, but I'm going to take the opportunity, since we have both CEOs from the hospitals and other medical professionals from Odessa, just to ask a couple of quick questions here. You know, you just mentioned a 35% positivity rate. And yesterday we had a press conference with the mayor of Midland and Odessa. And they continue to encourage the wearing of masks, though they were clear that there would not be an enforcement in our area. Today, you know, we spoke with Midland Memorial Hospital CEO and some other doctors, and they had a clear message to say that they're standing behind a mandate. Cases are rising, and they believe it's what's right for our community. So kind of wanted to get a grasp on how ORMC and MCH feels about that.
I'll be happy to go first. I can tell you that we saw in the early stages of this that masks do work. The masking did slow down the spread. We know that not only just in our community, but also in our state and in the nation, that when the mask mandates rolled out, it did slow the spread of that down. So we encourage everybody to wear their mask. We know some people aren't, but we think that wearing the mask does help. We know that not only in the hospital or in the mall or wherever you are, that if you're around other people, you need to have a mask on. And we see that it has worked. And I know Dr. SARAVANAN, he knows a lot about masks and has some good information, so I'll let him pick it up from there. Doc, go ahead.
Yeah, Violet, I mean, yes, we absolutely support anything that we can do with regard to pushing precautions off to the community. It is more than just a personal choice at this point in time. When we're talking about the entire community's health, you're going to have to come together as leaders and make some difficult choices. Whether it's popular or not is different than how it on the other end. I think as leaders, we are sometimes faced with those hard decisions where we have to do what's right for our community in the long term. And that's what we've been imploring our leaders to do as well. I do think that Odessa mayor and the city council have met recently, and they are going to enact some things that are going to help and still leave a lot of it up to personal choice. But for us as a community, the message that we need to give everybody is this is beyond that point where it should be optional. It should be mandatory for everybody if you know it's going to save a life. And it's very similar to that of seatbelts, right? So seatbelts will save your life, and masks could save yours and other people. It's like texting and driving. Well, it's illegal to text and drive. Lots of people still do it, but it's illegal to do that. And therefore it decreases the number of accidents because it's illegal to text and drive. So that's the kind of thing that we want to encourage in the community, is you want to be able to say, yes, you absolutely have to wear your mask. Are there still going to be people that don't? Sure, but just the statement alone will cause more people to do it and will cause this slowing down of the spread.
Thank you. And, looking at another part of this, we've spoke with several local business owners who are no longer enforcing the use of a mask that maybe at one point did or never have. And a lot of their answers is, well, it's not mandated by our mayors, so why should we? I think as leaders of the community, in business, what is your message to those people, or really anybody who has a leadership position, whether it's in business or healthcare or any number of things, despite there being not a mandate locally or no enforcement of the state mandate?
Violet, I've made this comment before, and I'll make one comment again, and then I'll pass it on to Dr. Benton as well. There's a social responsibility as we have as leaders. So when we as business owners have a certain influence over people that are walking into our business, it is our responsibility to protect those people as leaders in our community, because as business owners, we are leaders. And that is what our community is going to look at in the future and say, that person right there cares about me, and therefore I'm going to give business to them. And that's what we want to tell business owners to do. Dr. Benton.
That's exactly what I was going to say. I was going to turn it into leadership, and it is about leadership and leading in our community and demonstrate the example. The business owners, I understand that some may not want to come through the door if they're forced to wear a mask, but you can at least set that example for them. And it's very important. I think this is, again, back to part of community. The mask, certainly it protects me to some extent, but me wearing it protects you. And so we demonstrate our love for our neighbor by wearing a mask. And I think it's a great example of leadership that could happen in a community through the businesses.
Thank you both. Dr. MURI, one last question for you. Now, with the rollback of 11th and 12th graders, as you've been getting advice from medical professionals in the area, right now as it stands, is there any possibility of expanding that any further? And I know that, in yesterday's workshop or county commissioners meeting, there was an approval for more COVID cares money to go into supplies like Chromebooks and other, things that would help students learning from home. That's one part of it, you're worried about the health of these students, but the other part, we're looking at numbers where a lot of students are failing, and some students have never even registered for class or logged on, as I've talked to some teachers. How are you guys trying to find that balance to handle this? I can't imagine that it's easy.
It isn't easy, and there is a balance between education and safety. However, safety always has to weigh a little bit more than education. If our children are not safe, then they can't learn. And so safety is the primary driver for all the decisions that we make. Yes, we can take more if we have if we had an outbreak at a school, as an example, then we would take pretty significant measures at that particular school. Right now, again, our data doesn't indicate that we're spreading it inside the district. We're being, our cases come from the outside. But if for some reason we had cases that were occurring in our district, then we would take immediate action, cleaning action, closing action, moving action in order to ensure the safety of kids and staff members. But the academic toll that this is having on our students is alarming. And as a superintendent that is charged with educating, 32,000 kids now, I am deeply concerned about what all of this, the implications of all of this on the learning loss of our kids. It's going to be significant.
That's all I have. Thank you.
Sure. Thank you. Others, anyone else?
Hi, Dr. MURI.
Hey, Scott.
A+. Speaking of, if that happens and the kids get behind, how do you catch up?
Yeah, that's the $10 million question now. So we've already begun to think about that and put pieces in place. We just talked about technology. We're not sure what our virtual world may look like. Dr. SARAVANAN mentioned a vaccine, and yes, there is conversation of one, and we may see that. But by the time that vaccine gets into the bodies of our children and families, it could be months away. And if we don't get COVID under control, then the virtual world may become more a reality for our kids. So we've got to make sure we put long-term plans in place if we have to leverage that virtual world for a long period of time for students and staff members in ECISD. Next year, we're expanding elementary school through the summer. So we've added 30 additional days to our elementary school, pre-K through 5th grade. Every elementary child has an opportunity next summer to continue their learning for 30 more days beyond just the regular 180-day school year. We're helping our teachers figure out how to, what we call spiraling the curriculum. It is basically wrapping in those things that children may have missed with things they should be learning. So there are some strategies and tactics that we can leverage as educators to help our children. But at the end of the day, the longer this virus affects our children in the way that it's affecting them, then the larger the learning loss is going to be. And that's what scares me as an educator the most. I've already seen significant loss for many of our kids. We call that the COVID slide. And for some of our kids, they continue to slide because their world today is not normal. It is not what it should be. We're not able to provide the best education that we can because we have these barriers. Our teachers wear masks and face shields. The social distancing limits the collaborative time of our students. We've limited the use of manipulatives in some of our classrooms because we don't want to spread the germs. So lots of things that we would normally be doing with children, we're simply not able to do because of this disease. And it is absolutely affecting the quality of learning that they're receiving.
And the feedback is virtual's not working very well.
Yeah, for many of our students, it does not work very well. For some kids, it works exceptionally well. In fact, we do have some kids that actually are having a better experience. And for those kids, we want to continue that virtual learning. But you're right, for many of our kids, the virtual experience has not been optimal, partly because our teachers were thrown into this virtual world, with little training and preparation. Many of our teachers spent years preparing for the work that they do today, and suddenly they have to launch themselves into a virtual world. And so we've played catch up as a public school entity. We were not equipped. We didn't have many of the digital tools in the beginning of this journey. And so we kind of started a little bit behind. We've done a good job of catching up and potentially getting ahead, but there's a lot of work still left to do on the part of ECISD to support our kids in the midst of this pandemic.
Last question. We've gotten a little bit of feedback and question about quarantining. And when a student or a teacher has to go home because they've tested positive, what's the quarantine policy at ECISD? Because a lot of times the question is, well, everybody's staying in class and only that one positive case has gone home, where in a workplace setting, anybody who has come in contact with that person may have to go home.
It all depends on the situation. So our contact tracers look at the entire situation before they make a decision. They use the definition of exposure to help make those decisions. So that medical guidance informs the decisions of our contact tracers. And then based upon the level of exposure of a student or a staff member, that's what determines if they have to be quarantined or not. Clearly, somebody that tests positive is going to be at home. But that level of exposure really depends on the situation. For instance, if a teacher is wearing a mask and a face shield and tests positive, then the students in that environment, because the teacher was double protected and the kids had masks on, none of those students have to be quarantined. But if a student tests positive and they only had a mask on and their peers, then because of exposure protocols, some of those students and maybe all of those students may have to be quarantined. And so it really depends upon the situation as to the type and level of quarantining that happens. But we follow the guidance from the Center for Disease Control. The state of Texas TEA has provided guidance in that area, and the doctors that you see on the screen with me today, they also weigh into the processes that we use as a system. All of that information is on the ECISD website, so I invite anybody to visit the Ector County Independent School District website to find out the process that we use to make those decisions.
Great, that's all I got. Hang in there.
Appreciate you. Hey, thanks, Scott. Anyone else, either unmute or you can put your question in chat. All right. Let me close with just thank you to our doctors. Thank you to our hospital CEOs. It is an absolute privilege to work with you and to do this together. Ugly situation with the pandemic, but simply being able to have this incredible team makes this job much easier. So thank you for joining us today. And the work that you do in our community is incredibly impressive. So thank you all. And thank you, members of press. We'll see you next week.